affect working with the client? Think about the impact of the answers to these questions about the nurse-client relationship. How do you feel about the client? Do you feel sorry for or sympathetic toward the client? Are you bored with or afraid of the client? Does the client remind you of someone you know? Remember, the development of the nurse-client relationship can impact how the nursing process is implemented. Which brings us to therapeutic communication. That's the purposeful way in which you, as a nurse, interact with the client. You must demonstrate rapport, trust, respect, and genuineness for effective communication to occur. Nonverbal communication includes listening. You focus on the client and behaviors that are communicated nonverbally. It's necessary to face the client, leaning toward him. Maintain eye contact and an open, relaxed posture. You can even use silence to communicate presence and acceptance of the client. To be really effective, include broad openings such as, "Go on, tell me what happened, and how are you today?" Really good open-ended questions are the what, tell me, and how type of questions. Here are some examples. Clarification. Clarification is used to communicate understanding by offering another perspective. Reflection. You can use reflection to refer back to the client's feelings to help identify emotions and events that are troubling the client. Giving information. A nurse can give information by providing facts or education. Seeking validation. It's important that you seek validation and give feedback about the accuracy of your perceptions. You might say, "Is this what you are experiencing?" Or, "Do I understand you to say?" Next, summarizing. Summarize the work, the client's progress, or the client's goals at the end of your interaction. Closed-ended questions will get you simple answers from the client. Open-ended questions get fuller responses. Watch this nurse-client interaction and see how many barriers to therapeutic communication you can identify. In this role play, the nurse is uncomfortable talking to the client about a topic and doesn't want to continue, so the nurse changes the subject. The nurse also interrupts and moralizes by explaining what is right and wrong, or good and bad, instead of letting the client decide. The nurse gives advice to the client, indicating that the client is incapable of solving her own problems. In this interaction, a woman tells the nurse that her son is smoking marijuana and he has been skipping school. She just doesn't know what to do anymore. The nurse tells the woman to go on. The client says her son has missed 5 days of school in the last month, and her husband says she doesn't spend enough time with him. The nurse responds by telling the woman that smoking marijuana often leads to using other drugs and that it's really inappropriate for a 15-year-old. She offers a suggestion that maybe putting him in basketball or soccer can help. The client again expresses that she just doesn't know what to do. The nurse remains silent. The use of silence allows the client to express feelings and consider what to do about those feelings. The client adds that she just feels terrible about his drug use and poor grades. The nurse says to the client that she feels terrible and helpless because of her son's substance use and how it's affecting him in school. Hopefully you noticed that the nurse changed the subject, interrupted, and moralized by explaining what is right and wrong, good and bad, instead of letting the client decide. When the nurse gives advice to the client, it suggests that the client is incapable of solving problems. General guidelines for interacting and communicating with the client include: encourage the client to describe the experience, ask the client to describe his reactions to the experience, ask how he feels about the experience now, explore how a situation has impacted the client, and never assume anything. Let's apply it in everyday conversation. Your friend says, "I went home over the weekend," and you reply, "Wow, that's great, tell me about it." Now you've assumed that it was great. What if it wasn't great? Your assumption of the great weekend keeps your friend from recognizing his or her true feelings about the weekend. Or your nephew says, "I flunked out of college," and you reply, "That must have been really difficult for you. Let's talk about it." But your nephew never wanted to go to college, so it wasn't difficult for him. Your assumption stifled his true feelings. Instead, as nurses, we focus on nurse-client interaction with direct questions about the client's relationship with people. For example, your client says, "I saw my brother over the weekend." Instead of saying, "Wow, that's great," you would answer, "Tell me about your brother." A far less important question would be something like, "Where did you see your brother?" Lastly, nurses must speak only for themselves and only to their clients. Avoid statements like, "All of us nurses care about you," or "I'm sure your friend will understand when I explain it to him." Mental health disorders are brain disorders with a biological basis. The United States Congress declared the 90s the decade of the brain because of the many biological advances that were made, like neuroimaging, and progress in understanding the structure and function of the brain. Following the decade of the brain, it's the decade of behavior, 2000 to 2010, with a focus on improving health, safety, and education, and increasing prosperity. All mental health disorders have one thing in common: anxiety. It ranges from mild to moderate, and severe and panic. Mild occurs in day-to-day activities and is motivating. With moderate anxiety, a person's perception focuses on immediate concerns.
Benzodiazepines like lorazepam, Ativan, alprazolam, Xanax, and clonazepam, Klonopin, are used on a short-term basis or as needed to relieve anxiety. They can work within a matter of hours, or they may take 2 to 3 weeks to be effective. They should be used short-term because of the potential for dependence and addiction. Common side effects include sedation, dizziness, and ataxia. Clients should be cautioned to avoid activities that require mental alertness and change positions slowly if dizziness occurs. Medications should be taken with or after meals to avoid GI discomfort. Clients should not increase the dose or frequency without prior approval. The nurse assesses effectiveness by reduced anxiety associated with psychosocial stressors and anxiety disorders. And keep in mind that there are always new medications being approved to treat various disorders.
Severe anxiety leads to a very reduced perceptual field and a focus on specific details. Much attention is needed to redirect focus. Panic involves the inability to function or think clearly, and the person feels a complete loss of control. Each stage requires different interventions. The highest priority goal for a client with severe or panic anxiety is to lower the anxiety. Nursing problems associated with anxiety responses include anxiety, ineffective coping, and fear. Some of the most common psychiatric disorders include anxiety disorders, such as phobias, panic disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. Phobias are experienced when escape from situations is difficult or embarrassing. The client will avoid these situations or places, or endure them with distress, or by requiring a companion when in the situation. Nursing interventions for phobias include: determine the type of phobia and when it first appeared. Practice techniques for relaxation and for decreasing physiologic sensations. Accompany the client, but don't force the client to face the phobic object or situation on her own. Model unafraid behavior. Panic disorders are one of the most common anxiety disorders, and depression often accompanies panic attacks. Panic is a period of intense fear or discomfort. Assessment of panic attacks includes identifying physiologic symptoms: chest pain, nausea, sweating, shortness of breath, choking, dizziness, fear, or dying, and loss of control. Key nursing interventions include: keep expectations minimal, connect feelings to behavior before attacks, explain that anxiety causes sensations